Today we're going to be doing skill sets 9, and that's reconstituting a pediatric suspension today. So welcome to my channel. My name is Kiesha Smith. So first thing that we want to do is we want to verify the expiration date that is found on the bottle, which is this. So our medicine today is FLAVORx. That's what we're going to be mixing inside the water. So FLAVORx oral suspension. The expiration date on the bottle, you'll find it. It says December 2023. So you want to write that on the paper. And that's what we did. We verified the expiration date that's found on the bottle. And then we're going to determine our beyond use date. So I am making the medication today. And today is November 15th, 2023. And the beyond use date is always 30 days from the time that you make the medication that you form the prescription. So that would be December 14th, 2023. So today is November 15th, 2023, and then 30 days from now the beyond use date will be December 14th, 2023. So we got our beyond use date, and then we got our expiration date, which is found on the bottle. So step 2, it says read all the directions and complete any required calculations. And today we're going to be converting milliliters to drops. Provide written calculations with assessment form. So I have my calculations right here. So basically we have to do our calculations. That's always gonna be a routine in pharmacy and compounding and all of that jazz. So read all the directions and complete any required calculations, convert milliliters to drops. So we have FLAVORx right here. And with this skill set, my calculations is, first of all, our patient is Adele Wilson. So I forgot to say that in the beginning. So our patient is Adele Wilson. That is the patient we're going to be making the prescription for. And this is for basically little children, infants, when you're dealing with pediatric medications and things like that. Our patient, again, like I said, is Adele Wilson. And here are our prescription labels. And it tells us the patient name and everything like that. Okay, so we want to today add 15 milliliters of water plus add our orange flavoring. So this is our orange flavoring, and we want to add that to the bottle. So we're gonna have to add 15 milliliters of water in this thing right here. So we're gonna add 15 milliliters of water again, plus add our orange flavoring, which is the drops that we will add inside the water, which will be in the cylinder, into the bottle. And then we'll add the 15 milliliters, and then we'll add the drops into the cylinder, and then we'll put it into the bottle. If that makes any sense. Hope I explained that very well. So with our calculations, how we'll get that information is that we take the 0.3 milliliters of the flavoring in drops, and so the 0.3 milliliters of flavoring in drops So remember that we have to convert milliliters to drops. So that 0.3 milliliters of flavoring, which I found on the information on my sheet, is equal to 2 drops. So we'll multiply 2 drops times 3, which equals 6 drops of flavoring. So again, 3 times 2 is 6. So 6 drops of flavoring. So we take the 3 times 2, which equals 6 drops. I just explained that. So that's 0.3 milliliters. And that's the calculation part on how many drops that needs to go inside the water that will be in the cylinder. So with that, the 50 milliliter minus 6 drops, which is what they required for us to calculate and what we need inside of the cylinder. So the water needs to be 15 milliliters basically. So 15 milliliters minus the 6 drops that we just calculated is equal to 14.7 milliliters plus 6 drops of flavoring. So the water needs to be 15 milliliters, 14.7 milliliters, and plus 6 drops of the orange flavoring. But it needs to be exact. The water has to be exact. So we got our calculations. I have my calculations over here that I did. And then our patient is Adele Wilson again. So next step is review the label based on the prescription interpretation to verify correct days, supply, and dose. So Adele Wilson, she's going to be taking 400 milligrams, 2 teaspoons or 10 milliliters for day 1. Then take 3/4 teaspoonful, which is 3.75 milliliters daily for 4 days, and discard the remaining. Okay. So I'm making sure I go over the prescription label so I am correctly identifying how many days and the correct dosages that she needs to take. So that's what I just verified. So gather the necessary materials. So what we have is we have our water, we have our 50 milliliter cylinder, we have our orange flavoring, which is going to be the drops. Then we have our gloves, and then we have our medication with the Zythromax for oral suspension, 200 milligrams per 5 milliliters. And then we have our 5 milliliter syringe. So I have all of my equipment, I have my calculations, I have my prescription labels, and then our instructions. So next, we are going to be washing our hands. Grab our paper towel, turn the faucet on with the paper towel. Cut the faucet off with the paper towel. So what we're going to have to do next is put our gloves on. So that's what we just did. We just gathered our necessary materials. We just performed our aseptic hand washing technique. and then we put on our gloves. So now next step is we're supposed to subtract the exact amount of all the flavoring ingredients from the total amount of water needed located on the medication bottle. So they said that we need 15 milliliters of water and 6 drops. And I've already explained and did my calculations on how to figure that out. So next we need to subtract the exact amount of all the flavoring ingredients. So they have given us 0.3 milliliters of orange flavoring. So we need to subtract 0.3 milliliters of orange flavoring from the total amount of water needed. So what we got was 15 milliliters minus 6 drops is equal 14.7 milliliters. So let me kind of rephrase that, is that we need 14 milliliters of water inside of this. So with the 6 drops, it's going to be 15 milliliters. So step 7 says subtract the exact amount of all flavoring ingredients again, which is 0.3 milliliters of orange flavoring from the total amount of water needed, which is 15. So 15 milliliters minus 6 drops is equal 14.7 milliliters plus the 6 drops of orange flavoring. So I'm going to do that. So I'm going to grab my water and use my syringe Okay, I'm gonna have to pour some of this out because it's not right. Okay. So I'm pouring 14.7 milliliters in the cylinder with using my syringe that I have. Okay. So right here is 14 milliliters, 14.7 milliliters. So next we're going to put our 6 drops into our water. One, two, three, 4, 5, 6, So this is what I got, 15 milliliters. As well as the 6 drops inside of the water. Okay, so now I'm going to pour the 15 milliliters of water inside of our medication, which is Zythromax. And I'm going to shake this. So it says to follow the printed directions from the bottle. So I'm going to shake it. Shake well before using. May be kept for 10 days. Discard unused portion after dosing completed. So instructions: tap bottle to loosen powder. Add 15 milliliters of water to the bottle. After mixing, store suspension at the 5 degrees to 30 degrees Celsius. So I'm going to shake this. I'm going to open it. I'm going to pour 15 milliliters of our required amount of liquid that's supposed to go in the medication. I'm going to pour that in there. Okay. Put the top back on. Shake it. Okay. All right. So now we're going to label the prescription bottle, adding any necessary auxiliary labels. So in the beginning, I said that this is our prescription labels and everything that we need to put on our medication or on our prescription once we are finished with mixing and everything and reconstituting. So I'm going to take this first label, put it on the bottle. And then we have these auxiliary labels as well to help patients take the correct dosage and what to take the medication with and what not to take the medication with. So it says, if this medication upsets your stomach, take it with crackers, bread, or a small meal. I'm going to put those there. Okay. Initial the right corner of the label bottle. So I'm going to put my initials right here. KS. Place the additional label on the Skills 9 Pediatric Suspension Reconstituting Assessment form. So we're going to take this second one right here and we're going to put it right here. So that's what this looks like. We're going to put it right there. Okay, so I did that. Dispense the medication with the oral dose syringe. Explain storage directions and amount to give on the oral syringe to the observer, who will act as the parent of the patient. So next we're going to explain to the patient exactly what to do before they take their medication and after they take their medication. So I'm going to dispense this to the patient with the syringe. So here we go. Hi, Adele Wilson. So I am your pharmacist, and I will be telling you exactly what you need to do before you take your medication and after you take your medication. So what you will take your medication with is with this 5 milliliter syringe, and you will take 2 teaspoons or 10 milliliters for day 1, and then 3.75 milliliters daily for 4 days, and you will make sure that you discard the remaining. So before you decide to, take your medication, make sure you shake well. And if this medication upsets your stomach, take it with crackers, bread, or a small meal. Also, our patient is Adele Wilson again. She's a female, and remember that this is a pediatric suspension, so she is a child. And I want you to make sure you store at room temperature. So make sure that it's in the right type of environment, the right type of setting that it needs to be stored in. Let me see if I'm missing anything also to tell you. The medicine may be taken with or without food. And do not take aluminum or magnesium within 2 hours of taking this medication. So we're very big on that. We don't like our patients to take other medications or other things with the medication that we will give you. So make sure that you are just taking this, and if anything comes up, then make sure that you call us and let us know, or send us an email, and we will be glad to help you in whatever else you need. Just know that we are always here to help you and make sure that you are healthy. Your child is healthy. So that's all that I have for you today. So